Well, I've been at Mayo for about 25 years now. My background is in industrial engineering and health systems engineering. I went through school at the University of Wisconsin-Madison through a master's program, which at that time, when I went through back in the late 80s, there were only a couple schools that offered a focus on health systems engineering in the engineering programs, and Madison was one of those. So again, there are very few schools. There are more and more now, which is heartening to see, schools who are offering courses and concentrations and majors in health systems engineering. But one of the reasons I'm doing this conference is to try to, again, bring together people who are working in this field. I think we're stronger together than we are apart. And as we share learning, as we share knowledge, as we share our opportunities and the things we've done, I think we'll have a bigger impact on healthcare delivery in the U.S. than we can have alone. I firmly believe that. I think the Mayo founding fathers, the Mayo brothers who founded Mayo Clinic, felt very strongly that again, that's what they saw in their surgical practices. They went out and told people and showed people their best new surgical technique, and they went around the country to watch others and learn from others their best surgical techniques. They really felt that strengthened surgery across the U.S. And I think we feel the same way. That part of the reason we do this is obviously to share what we've learned, but also to bring others in who can teach us and share their learning, so that we can again be stronger as a whole than individually. And I think that's part of what drove us to do this. We have a systems engineering and operations research collaborative here at Mayo of all the professionals at Mayo Clinic. We have about 50,000 employees at Mayo, and we have probably at least a couple hundred who are doing work in kind of systems engineering, operations research at Mayo. And so we brought together a collaborative that brings those people together across Mayo, across the big organization in many different sites, to learn, to share, and we thought this was a natural extension of that effort, was to offer a conference beyond Mayo's walls where, again, we could extend the learning, extend the sharing of information. And so at the end of the day, that's really what the conference is about, is to bring people who are passionate about addressing the issues that healthcare faces today through use of these tools and expertise and approaches, and really bring them together to share and to learn.